This is the fifth section in the discussion on fourth generation photodynamic therapy. This is fascinating because when you activate the immune system, it immediately begins to attack the cancer. And you can see this by monitoring the white blood cells in the body. Initially, a huge percentage of the white blood cells disappear from the blood because they're off invading a cancer tumor and cleaning it up, killing the cancer and cleaning up the debris. Later on, the immune system starts to build extra white blood cells because it's saying, well, we're under attack, we've got to get a bigger army going here. Eventually, as it starts to clear up, your immune system goes above the normal. Even though you don't have an infection per se, the body has learned to recognize the cancer itself as an infection that needs to be fought. Now, cancer mounts a defense against this. It creates suppressor immune cells. Those cells tell the other immune cells to stay away. So what do we do about that? Well, there's a variety of supplements that can be used to combat that, and antibodies in extreme cases can be used. We've used both of them. We tend to stick with the supplements. We try to stay as natural as we can. So, how do you disable this defense? You need to reduce the interleukin 10 because that tells the killer T cells that would be trying to go after the cancer to become suppressor cells. And those myeloid cells that are converted to suppressors slow down the immune system. There's a number of ways that we can deal with this. We can use an antibody called GM-CSF, that's granulocyte macrophage colony stimulating factor. We can also use alpha interferon, both of which activate the immune system. Now, what's the end result of this? Well, you get results that simply are not available any other way. This is a picture of what's known as post-salvage breast cancer chest wall progression. And what that means is the patient has had surgery, they've had chemotherapy, they've had radiotherapy, and the cancer is now in the chest wall. And that's the point where the doctor, a conventional oncologist, shrugs and says, sorry, we can't do anything for you. You might as well go home and prepare yourself to die. Because they can't do surgery. It's in the chest wall. The only way to remove it would be to remove the chest wall, which leaves your lungs and your heart exposed to the open air. Not a good idea. Chemotherapy's already failed. Radiotherapy won't work. They have absolutely nothing to offer. So what happens if you put this harmless sensitizer in and shine a laser on it? Well, they did a huge study on this quite some time ago. This is what happens. A few days later, the cancer is dead. It takes time for the scars and everything to heal up, but a month or two later, it looks like that. Breast is missing, but that's not the fault of PDT. That's the fact that they went to a bloody surgeon, and the surgeon did what they always do. They cut things off. How good is it? Well, according to the study, virtually every photosensitizer in the world has some effect on this. Photophrins, some of the photoprin, if used with a high dose of sensitizer and a long source of light, gives a 91% complete remission and a 70% partial remission, which basically means it cures or reduces it in everyone. What do you do with the 7% that aren't completely resolved? Treat them again. Down here we have something called MTHPC. That gives 100% remission on the first treatment. Perletin, which is related to the grass that grows in your yard, to be quite honest, it's related to a chlorophyll molecule. That gives a 92% complete remission and an 8% partial remission. And again, with PDT, you can do it over and over and over if you need to. So You just go to the 8% that didn't completely get rid of it and say, well, look, we got rid of most of your tumors, but there's still one or two left. They're smaller. We need to treat you again next week. So come in and we'll start the next cycle of treatment. Now, that's the end of section 5 on this. In section 6, we'll discuss a little more of the details of the science behind it.